This conference will now be recorded.
Okay, we are now live streaming and you may begin the meeting.
Thank you, Benton. Welcome to the May 10th, 2021 Dietetics Advisory Council. It is 2:03 and we are holding this meeting virtually. At this time, we will be taking attendance. Judy Nagy.
Here.
Susan Fenn.
Here.
David Ryerson.
Here.
Mary John Ludy.
Here.
Carmen Clutter.
Here.
Benton, David is going to give a presentation later, so is there anything that you need to do to put him on so he can do that, to give him the ability?
Whenever he's ready, I can make him the presenter, and then he would have the ability to share his screen. Do you want to do that now?
No, let's wait just a couple minutes. Thank you.
Sure. Just let me know.
The minutes from the March 8th, 2021 meeting were sent to you last week. Are there any questions about those minutes?
Oh, they're okay with me.
Can I get a motion then to approve the minutes of the March 8th, 2021 Dietetics Advisory Council as drafted?
I so move. Susan Finn.
And could I get a second to that motion?
I'll second.
In a voice vote, all in favor say aye.
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 Opposed? No. The minutes stand as drafted. Thank you. At this point, I would have asked Chelsea Wansky, our legislative director, to give us an update, but she's at JCAR today, so I'm going to attempt to do that for you. One of the things that obviously comes up every month, especially this time of the year and this time of the biennium, is the budget bill. House Bill 110, the state operating budget, was passed out of the House and is now under review in the Senate committee process. I'm pleased to report that our initial budget request, which was granted in the executive version of the budget, remains unchanged in the House passed version. Our executive director, Stephanie Luca, provided testimony before the Senate Health Committee regarding the medical board appropriation. This is something we will obviously continue to advocate for our initial request as we continue to monitor the language throughout the remainder of the process. House Bill 122 is around telehealth, and it would permit specific healthcare professionals to provide telehealth services. The language requires telehealth services to be done according to specific conditions and standards. However, this language is nearly identical to the language we saw in the last General Assembly last year in House Bill 679. The bill was passed out of the House and is now pending hearing in the Senate. Senate Bill 131 and its companion bill, House Bill 203, are around reciprocity and would require an occupational licensing authority to issue a license or government certification to an applicant who currently holds a license, government certification, or private certification in another state. Both bills are similar, and the language is nearly identical to the bills that were in the legislature last year, one of which was Senate Bill 246. Our policy team is currently analyzing the impact of this language, and House Bill 203 has had 2 hearings in the House State and Local Government. Does anybody have any questions around any of the legislation? Kay, if you're ready, Kay Matko from the Ohio Academy of Nutrition and Dietetics will now offer a brief update.
Yeah, my comments are kind of related, but mostly to one piece of legislation and a couple rules. I'd like to start just by saying that the Ohio Academy of Nutrition and Dietetics submitted comments in support of the rescission of the current medical nutrition therapy rule, which authorizes billing for Medicaid patients, for dietitians who provide medical nutrition therapy. And they're going to rescind the old rule and replace it with the new rule by the same number. And the name's going to change to services provided by a dietitian. The new rule reorganizes the language from the old rule to make it clearer, and it sets forth the coverage and payment policy just like the old rule did. And in fact, the previous payment levels remain the same. The coding numbers remain the same. All that's the same. The new parts of the rule are that it adds federally qualified health centers and rural health clinics to be to the list of billing or pay-to providers. So that's a good thing. Those sites can get paid for the dietitians that provide medical nutrition services in those settings. And it adds lactation counseling services as provided by dietitians. So that's new to us. It also sets forth the reimbursement for those and the codes for those. The reimbursement levels are the same as for medical nutrition therapy. So individualized lactation counseling on the first visit would be the same numbers of $20.58 and $16.91. Same for the follow-up in the group. And the codes are the same, and there's just a TH added to the end of them. So it's much simplified. It's a nice new addition for us. And that hearing was held last Friday. I was the only person in attendance by telephone on the hearing. I don't know if anybody else submitted comments. I asked today, and I haven't gotten a response from Medicaid yet. But the reason I wanted to share that with you is, and the rule is supposed to be enacted July 1st. So it'll be coming up here pretty quickly. I wanted to share that with you because I also have other information that there is a bill amendment that's circulating that's sponsored by the Lactation Consultants group that proposes to license lactation consultants and issue a certification, a licensure certification for lactation educators within the nursing board. So the lactation consultants have gotten together and they've drafted language for an amendment. They're hoping to get it in the budget bill in the Senate. And if they can't get it in there, then they would go it alone as an independent bill later after the budget's settled. The lactation consultants would have to be IBCLC certified, so they have to qualify for and take the examination. Their scope would include performing assessments on moms and babies, analyzing data, care planning and execution, education and instruction on assistive devices, and making referrals to other medical professionals. The certified educators would complete at least 40-hour course that's approved by the Lactation Education Accreditation and Approval Review Committee, or the IBCLC. Their scope of practice would include providing lactation education and advocacy to families, healthcare professionals, and community about breastfeeding being the norm. They would also be able to provide general information, share personal experiences, and provide non-clinical support and encouragement for normal and uncomplicated cases, identify and refer high-risk moms and babies for appropriate medical treatment or to other providers, like to the consultants. Both licenses would require basic CPR, continuing education, diversity education, and general continuing education. It also authorizes the nursing board to set up an advisory council similar to ours. And then there is a prohibition section that's pretty strict, somewhat like the dietetics licensure law, that restricts the use of the terms, and this is important for us: lactation consultant, lactation counselor, lactation educator, or any other title implying that the person is a lactation consultant or lactation educator. So that may cause a little bit of conflict with that rule that I just discussed previously. So that's something that may have to get worked out. On my initial review of the bill, I'm not sure how it will fit in with the many dietitians who are also IBCLC or CLC certified and may do so privately and advertise, because I don't I think you'd probably just be restricted to calling yourself a dietitian. I'm not sure you could advertise that you provide consulting. So that's something else we're going to have to, I think, work on with them and find out. The other concern, the reason I wanted to bring to this group too, is lactation consulting isn't specifically included in the scope of dietetic practice, or licensure anyway. Certainly, lactation consulting is a component of nutrition services and medical nutrition therapy that's provided throughout the life cycle, but the specialty components of it at the higher levels, the higher risk utilization of devices and diagnosing things like tongue tie and its effect on lactation consulting, I don't think is generally taught in dietetics education, nor and the dietetics education can vary greatly. If you go to a school like Brigham and Women's, you're probably going to get a lot. Or if you go to a WIC internship, you're probably going to get a lot. But if you go to a very clinical general hospital, you probably just get basic education. So I think the medical board, as well as practitioners, are going to need to think about how dietitians are going to fit into this. The exemptions section, I think, does provide exemptions for doctors and PAs and dietitians to not have to have the additional license with the nursing board. But I think the medical board is going to have to consider perhaps looking at our scope of practice and maybe adding to it or developing rules in support of it, or talking to the nursing board and increasing our communication if this licensure goes through. I'm trying to see what else. Yeah, so my big concern is the Medicaid rule that's going, it's already had its hearing, and you can't really make a comment on bill proposal that's just kind of out there. Nobody's introduced it yet. Senator Coonsey is going to be the sponsor, but I know that they've talked to a lot of folks. They've talked to the governor's office, and I've been talking with folks from the IBCLC group and with the Children's Hospital in Dayton and Nationwide Children's Hospital here, just to try to get our comments together about it. The hearing on this is going to be held on the, it's either the 17th or the 27th. The 27th of May. 27th. I'm sorry, that's not this. Not this. This is the bill. So anyway, it's out there, and we'll have to see if it gets it in the budget and how it affects us. Then the other thing, any questions about that one? Okay, the other thing I wanted to let you know is there's also a Medicaid rule that's been proposed that will consolidate provider credentialing in the Department of Medicaid. Instead of providers being credentialed by the managed care plans, all that credentialing would go through the Department of Medicaid. They would set up their own committee that would do the credentialing, and then the providers would just have to kind of go, it's kind of a one-shop thing. So I think the intent of the rule is to make it easier on enrolled providers and facilities, because they have to credential with every managed care plan with whom they choose to contract. So I think, that's the intention, is to make it easier to do that. Of course, the rule lays out the whole processes and what you have to be credentialed, and how you go about applying for it. It also establishes this committee that's going to review the credentials or the applications and then approve them or not. And the thing that I see as a potential problem is if they deny you, you can't reapply. Yet somewhere in the bill, it did say something about there was a way that you could appeal. So there's a little bit of a conflict, I think, in the language there. So, you know, to say that you can only apply once and then you can never reapply, you know, what if you goof up your application or some piece of information changes? That seems to be problematic to me. So anyway, that rule is the one that has a hearing scheduled for May 27th. The Academy's gathering information. We'll be looking at providing comments about that. It doesn't particularly relate to licensure, other than our licensees are the credentialed providers that seek to provide Medicaid services. And I think that's all I have.
Thanks, Kay. There have been some administrative rules. Does anybody have any questions for Kay before I move on? There's been some administrative rules relative to dietetics, and this council has reviewed them in the past, and we've been kind of monitoring them as they've been going through the rules process. These were around limited permits, continuing education, and standards of professional performance. They've already gone through the public comment period, which ended, I think, in November, and have been filed with the Ohio Common Sense Initiative. I did want to take the time to thank Pat and Kay and the OAND for working with the board on these rules so that we could keep them moving, and we were happy to be able to make some of the changes that they thought were necessary for us to keep these rules moving. There will be a public hearing on these administrative rules on May 17th. And if anyone's interested in attending, either just to watch or if you have any comments, if you let me know, then I'll get you the link and we can get you signed up for that hearing.
Jill, can I interrupt here?
Yes, you may.
Just to say that the Academy will be submitting comments of support in all those rules, and also thanking Jill and Nate for working with us throughout the rule process on these too.
Oh, thank you, Kay. I'm glad I let you talk. You know, I've been thinking through what this council needs to be going forward and trying to make sure it's as substantive as it can be and should be for your occupation. And to that end, I know each of you signed on to do this council, and most of you have a passion around a specific part of your profession. And so I wanted to start giving you the opportunity for 10 minutes or so to highlight that. And I reached out to David and gave him very little notice, and he very graciously prepared something. And so, David, if you're ready and if Benton's ready, then you can have the floor.
Yes, just one moment here, and I will. There, Mr. Ryerson, you should have control. You can share your screen with us. Thanks.
Okay. Okay, is this, can you see my PowerPoint, or can you still see the GoToMeeting stuff up here?
I see the PowerPoint. I see it. You're okay.
Okay, good. Jill, thank you very much for giving me this opportunity, but thanks to everybody on the council for allowing me to be part of this narrative and this whole experience with the Dietetics Advisory Council. I am, as you know, a non-dietitian. I am a consumer member. I am a community member that serves on the council. And however, there are some parts of my work that have intersected in the past and continue to intersect in a lot of the conversations that we have on these council meetings. And I think that having a little bit of a time today for about 10 minutes just to take a moment to share with you about my role at United Way and what I do around food and nutrition and the investments that we make locally and some perspectives statewide about the importance of food and health. So I've been at United Way of Central Ohio for about 5 years, and I started doing a 3-year pilot program that was a Medicaid-funded care coordination pilot that connected wraparound services in the care coordination setting with managed care organizations. So kind of social service providers having access for reimbursement from MCOs, which is something that's still kind of getting off the ground. There isn't a lot of direct connection between managed care and human and social service agencies, but we're working on it. So that was kind of my foray, my entrance into philanthropy, and where what led me to United Way. But I wanted to highlight just a couple things. What I do is I oversee our portfolio of basic needs and our what's called Stable Families, Family Stability Programming Initiative. And obviously today I'm going to be just sharing a little bit about food and nutrition and those investments. So July 1st starts our next grant period, and we have just in the area of basic needs, which we include food, shelter, and access to services. So a lot of food pantries, a lot of housing agencies, and access to services, which could be transportation or even things like charitable pharmacy or access to supportive services like holistic care. We've invested $3.4 million over 65 programs in basic needs. However, there's a little over $700,000 invested in programs just focused on access to healthy food and nutrition-based community outreach, which is exciting. This investment is growing every grant cycle, and we're seeing a lot of innovation and a lot of acceptance of the importance of nutrition into underserved communities, not just necessarily the Medicaid population, but communities of the communities that are underserved or underrepresented, either at the policy or in the service level. This was our first grant period post COVID-19. So I think that what is most interesting about what we saw with the applications this year is the adaptations that a lot of pantries and food service providers made during COVID-19 to keep the doors open, because we also learned that the need here in Central Ohio and across the state as well, they saw an increase of demand or a need of their services by anywhere between 30 and 50%. And those are new clients. Those are people that have not accessed food support before, but COVID-19 kind of pushed them over that edge when they were kind of living on that fringe, or like a paycheck to paycheck scenario, or if they're, as we all know, when kids were sent home from school, how many families rely on the school district and the school system to provide healthy food for their kids. Another thing I wanted to share is that we're seeing more and more holistic wraparound supportive services. This is kind of like the care coordination that I initially mentioned, but it's something where nutrition education and access to fresh produce and healthy food is being built into more of a wraparound supportive like case management experience when a family is experiencing instability. It's no longer necessarily seen as like food insecurity as one siloed piece of something that they need to go necessarily to a food pantry, wait in line, and get whatever food they have access to or whatever food is available at the food pantry that day. We're seeing kind of this transition of it's part of a larger package in order to stabilize a family. It could be inclusive of things like rent and utilities. It could be the housing issue, which is huge. Families with kids that have to make a lot of moves is really disruptive to this child's education. And in so many cases, it's so often that food insecurity is either at the center or is part of that whole experience of that supportive case management experience. Fortunately, I'm seeing in the funding community, there's more of, I guess, a fluency or a growing support for infrastructure for fresh produce. And I'm talking about infrastructure, meaning anything with refrigeration, like paying for refrigeration for neighborhood or community-based pantries, which can be very expensive, to nutrition education programming. But also during COVID, it was really fascinating and just really awe-inspiring to see kind of, for example, emerging delivery programs and ways to get food to the families during lockdown and post-lockdown. And a lot of those adaptations are here to stay. They represent efficiencies in the way that they connect to the underserved communities. And so we're seeing a lot more applications and a lot more funding requests for some of those things that maybe they broke the digital divide somehow, or they're providing counseling through a virtual platform, but also, like I said, things like adapting the physical space where they can access food, but also partnering with other community-based organizations and delivery programs as well. And also growing support for nutrition education programs. And I think this is across the state, but I think in Central Ohio, I cannot play favorites, but I have a few programs that have been in this game for a long time, emphasizing the need for educational programming for families that, for instance, that are part of WIC or that receive SNAP benefits that are definitely shopping on a budget, and they can basically access a variety of different classes that will teach them how to grocery shop on their budget and what they can do and make with the limited budget. These simulations are really exciting. If anybody's interested, please let me know. I would like to connect anybody that's interested to these funded partners, which I am very proud of. So next, so this is something that I took from the Ohio Association of Food Banks, and it's, with the focus and relative to hunger and health, it says that the experience of food insecurity is not only one of indignity, injustice, and short-term suffering. Food insecurity is also associated with some of the most costly and serious health problems in the U.S. And too often, food insecure Ohioans have to make impossible choices that further threaten their health and well-being and their ability to mitigate or manage chronic diseases, including choosing between buying food or paying for medicine or medical care. So that's kind of the hunger and health connection, and kind of the passion I have advocating for communities that don't necessarily have a loud voice, and may not even be fully taught or aware of the impact of their diet, nutrition, and health has, and the critical role it plays in this cycle, which this is, again, something from Feeding America, but this is a very helpful chart that I find that kind of describes the cycle of food insecurity. Starting here at the top where you experience food insecurity, there could be community interventions right here at the next stage, but it kind of goes where a family or an individual is engaging in coping strategies, including reduced dietary quality or intake, all the while developing new or worsening chronic diseases, leading them to a traditional clinic intervention. Disease complications continue to grow, and then it leads them finally to traditional hospital intervention, and realize the reduced employability and rising healthcare costs, and finally making more spending trade-offs with less household income, trapping them in this cycle of, food insecurity causing this kind of cascade of things that is really hard to navigate yourself out of. And then finally, this is, like I said before, I can't really play any favorites. We have a lot of investments in nonprofits in Central Ohio locally that do a lot of this work. And I just kind of wanted, I just picked 5 that I really like that I wanted to share up there And I can also, I'm willing to provide more information on any of these programs and what their impact is on nutrition education. But Children's Hunger Alliance, a local Community Development for All People, which is a neighborhood-based organization that has for many years run a really great healthy eating and living initiative. Local Matters, which those of us located here in Columbus or Central Ohio are probably familiar with Local Matters and perhaps their social enterprise of teaching healthy cooking at work sites, kind of as team building activities. FESTA, formerly known as Serving Our Neighbors Ministry, is a program that I'm very passionate about. It's a free summer lunch camp sponsored by the USDA for food insecure families and emotional poverty. It's a very like all-encompassing whole family approach that's based on the summer lunch camp. They also have a lot of other nutrition-based activities that engage kids at a very young age, including they operate their own restaurant, and they will, I think the theme or the title changes, but it's really interesting. The kids do everything, and this is like middle school kids, intermediate school, and high school kids. They do everything from all of the prep, all of the cooking, the menu selection. They take all the orders, everything. Again, it's kind of like a social enterprise piece, but I'm really proud of the work that they've evolved to get this little mini restaurant operated by these kids. And finally, Westerville Area Resource Ministry offers an abundance of adult and child nutrition programs. United Way also partners with Mid-Ohio Food Bank, and Life Care Alliance operates our local Meals on Wheels program. Meals on Wheels may be operated in other parts of Ohio by other organizations, but they're one program that we are heavily invested in. And there's a lot of others. Like I said, it's over $700,000, and I am advocating here to increase those investments. And then lastly, I will close out by sharing a video that it's a campaign video for Mid-Ohio Food Collective. So don't feel like you have to contribute any money. That's not the point. But I wanted to highlight some of the accomplishments and the direction about this whole food is medicine and concept. So I am going to start this, and then once that's over, please feel free to ask me any questions. Let's see if I can. This. And I often say, because access matters. We deliver 74 million pounds of food. We deliver 600,000 deaths. Because more than 60% of our food. Because our customers need watching the pivotal other response. Think of one mother shopping for food. Get to the pantry while it goes. What do you expect? Hundreds of thousands of removals every year. Time to reimagine how we address hunger and growth. Mid-Ohio market for food access created communities first experience. Customers safe to play out abundant food. They do stronger, more convenient hours. Families can access healthcare, housing, jobs, and nutrition. Mid-Ohio market for convenience and convenience. And they work. Data from our two pilot sites offer resounding proof. Mid-Ohio market dramatically increased business and decreased waste. This is the future sending home. And this is the future of urban farming. Starting in our hilltop community, each Mid-Ohio farm will be a community center for
Here, neighbors attend parties, restaurants, events, and classes will engage residents with discussions around agriculture, job training, nutrition, and science. Cutting-edge smart farm techniques will be introduced. From climate control greenhouses to robotics, from sensors to new growing. With data, we can understand our customers. With real-time, dozens of organizations, sectors across the country, all united in one place, we can provide customers exactly right food, right place. That is the promise of the data. We need to use visual applications to learn each customer and respond to tailored research. The challenges of hunger. Imagine the middle house food for us. Refresh to meet the needs of the new home. Among the proposed changes, selected aside to the production, place, convenient, nutritious meals, where up to 7,500 meals will be cooked each day to use for early lunch after food. Patients, drive healthy food by our healthcare partners of weekly action. As our understanding of hunger evolves, our facilities must be safe. As we start this course together, I want to share with you the future that I see. It's a future where families can access food when they need it, but the hidden barriers, the long pressure of cancer, the stigma relying on health, torn down. A future where residents come together, collectively invest in their neighborhood. A future where everyone thrives. No you there's a vision for the research. We believe the philanthropic investment, $30 million, will help to make this vision true. This is a moment of transformation, one that is rooted in you. Thank
Oh, yeah, I think that's it. And I just want to close by saying thank you for letting me be part of this. And please let me know if you have any questions.
Are there any questions for David? David, that was a really powerful presentation. Thank you so much.
Yeah, so
Thank
David,
you.
I have a question. So I do want to say thank you. And my question is, what sort of partnerships are you hoping for from dietitians that maybe you're not getting or maybe could be amplified?
So I think that the Medicaid conversation is really important. And I think that whatever can be advocated on accessing, like, for instance, if we're talking about reimbursement from Medicaid for diet, like consultation or nutritional education, I think that's something that, especially with expectant mothers and the investments that we already make around infant mortality, is something that we would want to be more integral into the whole package of our collective effort of reducing infant mortality. That's just one example, but I think that getting the the field of dietetics, I think I would be looking for any opportunities to make those connections where if there is an agency, an institution, or any kind of facility that is supporting or providing food, that there is an emphasis on the nutrition and the health benefits and using dietetics as a preventative measure for a lot of devastating health issues that disproportionately impact underrepresented and underserved communities, especially like hypertension, high blood pressure, obesity, and infant mortality.
David, this is Pat. One of the things that that I've learned, of course, is that Mid-Ohio Food Cooperative is working with hospitals now to do, I know Mount Carmel's working on the food pharmacy, so I think there's so many people doing so many great things. It's just great to have, and sounds like what your agency is trying to do is coordinate this a little bit better. That's important to do too. Thank you.
Yeah, thank you for that. Thank you for that acknowledgement. The food pharmacy, that's pharmacy spelled F-A-R-M. And it's just any time or any opportunity I have to put that out there or advocate on behalf of the work of food pharmacy, but also partners like Mount Carmel. I think it's just, just getting this more, everybody outside of the healthcare field or like dietitians, it's just to get it to more of the human service and social service field and just elevate the language, elevate the importance.
And pre-COVID, Mount Carmel was doing a lot more of that kind of thing. But now, of course, with COVID, they had to stop doing some of the things they were doing. But I think that's in process right now to try to increase some of because the Heart Food Pantry, I guess, in Reynoldsburg is another one that they've used to. So there's so many avenues where these kinds of things can happen, and Mount Carmel's really just starting that food pharmacy. I know OSU has it. I guess has been having it for a good while. So you see,
it seems to me, David, have you been participating in any of the dietetic meetings? It seems to me your basic level dietitian would want to know that and might be very creative in coming up some ways they may do that and expand your message into the many programs they're working in diverse settings. I think that is a natural. I mean, even in the state, I mean, how important it is broadly you disseminate what you're doing.
Right.
I would recommend that you get it on Mary John, maybe, getting him as a presenter in some of these meetings. Mm-hmm. They're natural.
I definitely have those connections. And I appreciate David speaking here. And, I also just really appreciate the opportunity to hear about what other council members are doing. I feel like that's just a great way to amplify voices. So thanks for suggesting it, Jill.
Well, thank you, David, both for your presentation and for me goading you into this with 3 days notice. So thank you so much for doing that. If you don't mind sending that to me, if you think you're ready to send it out, and then I can send it to all the council members. If I'm sure they would like a copy of it as well.
That'd be good.
Jill, can I add one more comment?
Sure.
This is Kay. I was just traveling in rural North Carolina this last week, and the Dollar Generals, there's a Dollar General about on every corner.
That's right.
But they have some of the best produce now. They have added produce into their Dollar General stores. And really I saw families really, because we forgot a lot of things. We were doing a lot of cooking where we were at this Airbnb. And there were families in there doing probably their week shopping. And there was a lot of educational material posted near the fruits and vegetables. I was very impressed with the incorporation of good, healthy foods in those stores. But I also was thinking about the need for education, because I know, at least in some of our Dollar Generals here, some of the canned products and packaged products they carry are nearing the end of their shelf life. And there's a lot of education that needs to be done there for families that need to make a wise decision when they're purchasing something.
Thanks, Kay.
It's great to hear. I hope that catches on, and I love stories like that. And I hope that maybe in the future I can share some more detail on it. I'm glad that Pat brought up the food pharmacy. There's just so much there. I just didn't really think that there was there's too much time, I guess, or I don't have that much time. But thank you for this.
How about everyone, we'll go through everyone and I'll email everyone and give everyone an opportunity to figure out what their passion point is that they want to talk about. And then maybe we'll give a couple minutes for follow-ups as we go along. I also wanted to let you know, I always email Pat and Kay and let them know how many licensed dietitians still haven't renewed. We've had a lot of confusion with all of our licensees over the pandemic because it's been kind of a moving target, but with the legislature extending the dates for licenses. So, and I know that I got an email from Pat, I think, saying that was on OAND's website and that Kay had sent something out as well, or the organization had, thank you, Mary John, to the organization and to all of your licensees. So we still have 620 licensed dietitians. If you're out and around and if you can do anything to help me make sure we don't lose anyone, I would appreciate it. As we were talking about before we got started here, we do have a couple of members whose terms have expired. And we were able to have everyone on here today because we have 60 days after the term expires for you to be able to remain on the council. So I'm happy that we didn't have to cancel this. Until recently, we only had a couple of applications. I reached out to you guys, and now we have so many that it's going to take me a few days to go through them. So I promise you I will have that done. And I know that Bryson and I have been sitting in on some interviews as well. So to that end, I want to introduce Bryson Hatfield. He's been with us now a month. About
a month or so, give or take.
So he is taking Sierra's spot. And so we are happy to have him with us, and you will be getting emails from him. And I just wanted you to be able to see his face and put his name with the emails so that you're not wondering now, who am I getting emails from the medical board. Our next meeting is August the 9th. Oh my gosh, it should be really warm and dry out by then, I hope. Is there any other business to come before the council?
Oh, Jill, I have to say something good because you do done so much for us, and we are so thankful to have you. The support that you've given us has just been wonderful. So thank you.
All of you, and I appreciate the work you do every day. So thank you very much. If there's no more any more to come before the council, can I get a motion to adjourn?
I so move.
And could I get a second?
I second.
And a voice vote. All those in favor, yay.
Yay.
All opposed, no. And that
This conference is no longer being recorded.
guys. You'll hear from me in the meantime, but I'll see y'all in August.
Okay, bye-bye now.
Thank you.
Thank you.
Thank you.
Are we online in August, or are we thinking we'll be in Columbus?
We don't know.